I want to thank everybody who came to testify today. Really appreciate the time. Muchas gracias a las personas que vinieron a dar testimonio. La verdad es que aprecio mucho que han tomado su tiempo. I just want to, just say something about what we're doing here. The truth is that at the national level, we have seen how our Latino community and our Black community has been disproportionately affected by this pandemic. Montgomery County is no exception because we mirror the makeup of our nation and also the world. And I've been very proud to serve with my colleagues because if you break down in terms of demographic profiles, each council district has a large proportion of Latino residents, except District 1. But every single other council district has a large proportion of Latino residents. Mine just happens to have the largest proportion. And each at-large council member obviously represents all of these communities. And so from the very beginning, I have been really, really grateful to how each council member has zeroed in on the needs of these very vulnerable communities. And we do it because we care. We do it because we understand that it's important. But there's another component to this, which is the public health needs of our community and the race to address the spread of this virus. So it is so important that we zero in on the needs of our most vulnerable communities because it has an effect when we talk about public health on the entire county. And I want to absolutely thank Councilmember Albornoz. When we finally received the data that we had been asking for a while, it just became really clear that a lot of the things that we had been worried about and that we had worked so hard to address, unfortunately, those efforts had not been enough. And so, we quickly just huddled and said, we got to do something about this. It was very clear to me that it needed to be a systems approach, that needed to be targeted, that needed to be scalable. And very quickly, we got together with first the county executive to let him know that this was imperative, but then second with our community leaders, right? It's just amazing how the Latino Health Steering Committee, they have people like Monica Escalante, Angela Sainz, Ana Maria Izquierdo, Olivia Carter, Maria Gomez, Diego Uriburu, Grace Rivera Oven, and many others. The Latino Health Initiative that is led by Sonia Mora, who is just an extraordinary leader. Our staff, I know Berta Cersosimo from my office has been working around the clock, as well as Beth Schumann and Lee Cruz and Mayra Bayonera in Councilmember Albornoz's office. Everybody came together with the amazing Linda McMillan, and like in 9 days, came up with this initiative, which is an extraordinary template that, as Councilmember Rice mentioned, I reached out to him and said, this is the type of template that would also work in our Black communities. And this is how we need to do the work. I think that we've learned a lot during this pandemic. One thing I now am convinced is that this is how we need to approach these kinds of challenges. It has to be through a systems approach. It has to be through coming together with the community so that you can achieve that cultural and that linguistic proficiency that is so critical when you're trying to basically race against the clock. And so that's where we are today. And I will say this also for the record. I know that, this is a time limited effort because, of course, of the funding that we are accessing. I very much am completely committed to making sure that this model continues because I think in the end is what's going to give us the best results, and it's going to be the best use of our resources. So again, I want to thank all my colleagues, Councilmember Albornoz, the extraordinary community that has come together. This particular model includes enhanced communications, outreach and engagement, clinical follow-ups, testing and contact tracing, case management, funding to sustain and expand the community hubs that Grace Rivera Oven up in Germantown has done an amazing job. And it also establishes a Spanish language hotline, and also the development of the hiring of more health promoters, which is another way that we can capitalize and use our own resources in our own community to get this going. So again, thank you. It's been exhausting, but very exciting to finally get here. And the executive indicated to us, to Councilmember Albornoz and I, when we met with him, that he was absolutely committed to supporting this initiative and providing the funding. And so I know that the Health and Human Services leadership, Dr. Poole, everyone is going to work to make this a model and for us to realize our results. So with that, I'd like to move this